Hey guys, Dr. Joanne Michelle Martin here, pelvic floor physical therapist specializing in the pregnant and postpartum patient. What is pelvic floor physical therapy? Oftentimes I have people ask me that. They ask me, well, how can this be beneficial to me? How is this helpful? Basically, your pelvis is a complex region of your body. As you can see here, this is part of the spine, this is part of your lumbar spine or your lower back, and below that, you have your sacrum and your coccyx or your tailbone, and surrounding that, you have your ilium, your ischium or your sit bones, and your pubis or your pubic bones, with the pubic symphysis or the cartilage in between there. Additionally, as you can see when you look from the top view, the pelvis houses the rectum, the uterus, and the bladder, so it holds your reproductive organs. And it also holds your bladder and your rectum. So it has a huge role to play in peeing and pooping, which everybody does. Certainly, then you look and you see the muscles. These are the external muscles, or the first layer of muscles, the most superficial one. And these muscles play a strong role in sexual function. If we look top down, I'm going to take the organs out here. If we look from this view, you can see some more muscles in here, and those are the deeper layers of the pelvic floor. Now, oftentimes, again, people will ask me, well, why do I need pelvic floor physical therapy? The pelvic floor has a number of functions, including continence or keeping you dry. So it plays a role in helping you to control your bowel and bladder. It plays a role in supporting these organs, the ones that I just removed. And it also plays a role in stability. So the muscles stabilize the pelvis to allow for your legs, your hips, and your trunk to move. The muscles work in a coordinated fashion with your abdominal muscles and with your multifidus, or your the deep muscles of your back. And your diaphragm to form the core unit. And the core is what everybody talks about that really supports the body. Well, your core is not just your abs. Your pelvic floor plays a huge role in that. In addition to that, these muscles help to act as a pump to help control the flow of fluid in and out of the region, so that there is not any type of congestion, so there's not any type of swelling. There are a lot of people who will have pain and swelling and varicosities, either when they're pregnant or otherwise, in the pelvic floor. So there are a number of things that these muscles can do. There are a number of issues that may come up for people. This may include pelvic pain, leaking or incontinence, whether it's of urine or feces. Anytime people have consistent and especially over a long period of time, chronic pain in the hips and or the back, we want to consider the pelvic floor muscles as one of the main hip muscles attaches directly into the pelvic floor. Anytime people are having any type of neural issues, things like, most people may think they're having sciatica because they're having pain radiating into the buttock region. And oftentimes you want to screen and make sure that this is not a pelvic issue as well. If people are pregnant, if they're postpartum, if you are having issues with fertility, if you have had a cesarean section, if you are menopausal, and so much more. So if any of these things sound like something that you may be going through, then please contact a local pelvic floor physical therapist, or try to seek out a pelvic floor physical therapist who offers online consultation, such as myself, as many of us do, to try to, work through what your issues may be, to come up with a program that is unique to you to get you on the road to healing and to improvement. No one should be sidelined because of pain, because of leaking. And oftentimes in society, we talk about how things are common and we accept them. Well, guess what? Common is not normal. And just because something is common, for instance, incontinence, some people may have sexual dysfunction, just because they may be common does not mean that they're normal, okay? So that's why pelvic floor physical therapists are here. We want to help you. So if you have any questions, please feel free to email me at info@jmmhealthsolutions.com. Take care.